Okay, it looks like there hasn't been anyone additionally that has joined, and so I think it's safe for us to get started. Thanks again for joining our session. It looks like we have a fairly small-sized group, so this will be a very intimate conversation, and hope that you all will feel free to speak and share and interact with us as we go through the presentation that we prepared for you today. My name is Tracy Urban, and I am the County Child Care Program Operations Section Chief within the Child Care and Development Division of CDSS. And I'm here with a group of people from our team, Alana, Jane, and Mona, who are members of our Stage 1 and Bridge Program Policy Support Unit. And they'll reintroduce themselves as they join in this presentation. Before we get started, we're interested in learning about those of you who have joined us. Please use the chat to tell us your name, your role, and the agency or program that you represent. And like I mentioned at the onset, we would like this experience to be interactive. And so please use the chat or feel free to come off mute and comment or ask questions throughout the presentation. We will have a question and answer period at the end, and we'll address questions from the chat and any other questions that are raised. Also wanted to share at this point that we also have our slide deck with the available that will be available to you after, as well as a resource sheet that has compiled all of the links that will be spoken of during this presentation. So make sure that you know that will be coming your way. So today we're going to talk about the California Work Opportunity and Responsibility to Kids, CalWORKs, Stage 1 Childcare, what the program is, how it works, and most importantly, how access to childcare supports family stability and prevents child abuse. For professionals working with families, childcare often becomes one of the biggest barriers to stability. Without safe childcare, parents cannot attend required activities, maintain employment, or manage crises. Programs like Stage 1 are designed to remove that barrier so families can focus on building safety, stability, and long-term success. One more note before I pass it on, I want to remind you that we would really like this session to be very interactive. And so we encourage you to use the chat and to participate actively. And we will also be asking you some questions as we go along. And so we really appreciate your engagement. I'm going to pass it along to Alana. Next slide, please.
Hello, I'm Alana Lee, and I'm an analyst in the Stage 1 Childcare and Bridge Program Policy Support Unit. CalWORKs is California's version of the Federal Temporary Assistance for Needy Families Program, or TANF. I'm sorry, could you move to the next slide, please? Okay, there we go. The goal of CalWORKs is to provide financial assistance while also helping families move toward employment and stability. Families receiving CalWORKs often face multiple stressors, including financial hardships, housing instability, and caregiving challenges. Childcare is a critical support that allows parents to participate in the activities required for their CalWORKs case plan. Next slide, please. The CalWORKs childcare program is administered in 3 different stages and is defined as follows. Stage 1 is administered by county welfare departments or their contractors. The program begins when a family starts receiving CalWORKs cash aid. CalWORKs clients may be served in Stage 1 until the county determines that the family situation is stable, or if no funds are available in Stage 2. Former CalWORKs recipients are also eligible to receive childcare services in Stage 1 and/or Stage 2 for a total of no more than 24 months after they leave cash aid. Stage 2 is administered by California Department of Social Services also through contracts with alternative payment programs, or APPs. The APPs are agencies that contract with CDSS to make payments to subsidized childcare providers and to provide other related childcare and development services. Stage 2 serves CalWORKs recipients whose situation has stabilized or families that are transitioning off of CalWORKs. Families that receive lump sum diversion services may also receive childcare in Stage 2 if there is no funding available in Stage 3. Families leave Stage 2 when they have been off cash aid for 24 months. Stage 3 is also administered by CDSS. This stage provides services for former CalWORKs families after they have been off aid for 24 months and for families that receive lump sum diversion services. Families could remain in Stage 3 until the family income exceeds 85% of the state median income or until the children are over the eligibility age. Today, we'll be focusing specifically on Stage 1. Next slide, please. Next slide, please. Stage 1 childcare is a CalWORK supportive service administered by county welfare departments or their contractors. It is designed to remove barriers for families that prevent them from becoming self-sufficient. As such, services begin upon entry into CalWORKs. In Stage 1, a family's childcare authorization is immediate and continuous for 24 months. Immediate means that the concurrent approval of CalWORKs cash aid and authorization for full-time CalWORK Stage 1 childcare. Continuous means that the family does not need to have their childcare reauthorized for 24 months with certain exceptions. Next slide, please. Parents are eligible to receive immediate and continuous childcare services when there is no parent, legal guardian, or adult member of the CalWORKs Assistance Unit living in the home that is able and available to provide childcare. Two-parent households are also eligible for immediate and continuous childcare services if both parents are participating in welfare to work activities, are working, or are otherwise unavailable to care for their children. Eligible children are children who are 12 years of age or younger. If they're disabled, they can be up to 18 years or older if they require childcare or supervision because of a physical and mental disability. For children ages 11 and 12, use of an after-school program is preferred. I will now pass it to Jane for the next slide, please.
Hello, I'm Jane Andrews. Like Alana, I'm an analyst in the Stage 1 and Bridge Policy Support Unit. I'll cover the types of childcare that is covered by Stage 1. Parents have choice in selecting childcare providers that meet their needs. Licensed childcare and childcare exempt from licensure are valid parental choices. To be eligible, childcare providers must be at least 18 years old and can be any of the following types: licensed childcare centers, licensed family childcare homes, licensed exempt centers, and licensed exempt providers that are registered for Trustline or are Trustline exempt, such as aunts, uncles, or grandparents. Licensed exempt providers are especially accessible to parents who work non-traditional hours, such as nights and weekends, when most licensed centers are typically not open. Licensed exempt providers are not required to be licensed to provide care for children, but must complete a health and safety certification form. They can care for their children and the children of one additional family. Next slide, please. Stage 1 supports child abuse prevention efforts by fostering safe, stable, and nurturing relationships through childcare. More specifically, it supports stability. Research shows that when parents can't access affordable, flexible, and reliable childcare, they may be forced to miss work or leave their children in unsafe situations. Childcare offers predictable care, allowing for consistent participation in work, education, or training. To that end, it also offers peace of mind. When parents have access to childcare, parents know their children are safe, allowing them to go to work or activities that help them take steps towards financial independence and thus reducing stress. Childcare provides continuity for children by offering stability and routine and nurturing relationships. Lastly, by providing childcare, there's an added layer of childcare provider support. Childcare providers may notice red flags that signal a family might need additional support, creating a safety net. As research has shown, relationships with caring and supportive adults provide a protective resource for parents and children. Childcare providers are well positioned to provide this kind of support. So before we move on, we'd like to know how many of you were already familiar with stage one childcare today? Um, please share a yes or no in the chat if you can. How did you learn about stage one childcare? Oh, thank you, Andy, for responding. Um, okay, quite a few no's. Oh, thank you, Marissa. Yes. Oh, another yes, but unfortunately, quite a few no's. Oh, thank you, Selena. And is there anyone else who'd like to share? You can put something in the chat or you can come off mute if you'd like to share a story. Okay, well, thank you for your responses. One of the goals of sessions like this one is simply increasing awareness so that more professionals know this support exists. We have another question. How many of you have worked with a family who struggled to find childcare while trying to work, attend school, or participate in other activities? Um, yeah, quite a few yeses. Oh, yeah, it does happen often, unfortunately. Thank you for sharing your experience in the chat, but we'd also like to hear your experiences. So if you feel comfortable, please feel free to come off mute and share them with the group if you'd like. So, okay. Um, what we
Jane,
often hear from, oh, sorry. Yes.
it's Mona, but I have a story I can share from. I'm one of the presenters, but I have a
Oh,
story I can share from one of my previous
perfect.
roles where I really started learning about how important childcare was. Um, oh, and Marissa's going to share too. Great. I will speed it up
Thank you,
then.
Marissa.
So, in my experience, I used to work in substance use recovery services, and childcare was a huge barrier to engagement, especially for the families that were participating in really intensive outpatient programs. So we had like Monday through Friday, 8 to 5 programs, and so 40 hours a week, and so. The folks were really motivated to attend services, but it was hard to do so consistently because they didn't always have reliable childcare or safe people to leave their children with. And so we had to get really creative sometimes. And so that was really one of my first experiences. And I will let Marissa share. Thank you.
Hi, everybody. So for my experience, I've had participants like need childcare, but then they have a hard time trusting folks taking care of their children. So they go to like the next family member, but then the family member becomes like not consistent with the hours that they're available. They have a lot of barriers to get onto like the registered trust line. So yeah, that's a hard part for some of my participants. And then
like the friend that I had, I remember them struggling like finding a childcare center that they felt comfortable leaving their child um there for, for an 8-hour shift a day. So it's definitely challenging. Like I'm not a parent, but I can only imagine, you're away for 8 hours, and then thinking about like your child, like, are they okay? Will they, especially when they're so little and they can't voice or speak on their own behalf of what they need. And then just the emotional, like the attachment part too. So yeah, I definitely feel, and I'm so happy to hear that these are the programs that are available. But thank you for listening.
And I thought one other participant wanted to share, or was I mistaken in that? Okay. Um, is there anybody else who would like to share their experiences? Well, thank you for those of you who shared. What we often hear from families is that childcare can be one of the biggest barriers to stability. They may want to work, attend training, or meet program requirements, but without safe childcare options, it just becomes incredibly difficult. That's exactly where programs like CalWORKs Stage 1 childcare are meant to provide support to remove that barrier so families can focus on moving forward. Next slide, please. When we think about child abuse prevention, we often think about intervention after something has already gone wrong. But prevention also means addressing the stressors that place families at risk. Uh, Protective factors supported by childcare include reduced parental stress, increased and improved economic stability, ensuring children are in safe and nurturing environments, and supportive relationships with childcare providers. Childcare providers can also become important support systems for families. Next slide, please. So I'd like to pause for a moment and tap into the expertise in the room. When we talk about childcare prevention, we often talk about protective factors, things that strengthen families and reduce stress. Um, please take a moment and think about the families you work with. Let's see. How might access to reliable childcare change the dynamic for that family? What pressures might it relieve? What opportunities might it create? If anyone is willing to share, we'd love to hear what comes to mind. If you'd like to share in the chat or come off mute and share with the group, that would be very much appreciated. Okay, so we're going to move on. A lot of professionals working with families identify that obtaining childcare for families they work with would mean reduced stress, increased stability, and safe environments for children. And that's exactly the outcomes programs like Stage 1 childcare are designed to support. Um, I'll now pass it on to Mona for the next slide.
Thank you, Jane. I saw Marissa's comment to the mindset changes. I think that's so true. And Marissa, I'm going to put a link in the chat. Um, when I finish my presentation, there is a childcare licensing transparency site, and it allows folks who are looking into like the different childcare centers, they can read reports from licensing. And so when I worked with families who had some of the, fears and fear of trust of certain childcare providers, that really helped them. Like empowered them to make the right decision. So I will share that link with you. I have that in my head as soon as I'm done talking, but I wanted to throw that out there in case it's ever helpful. Because I think in my experience, I learned that a lot of families don't even know that that exists. So Thank you. All right. So, can we move on to the next slide, please? Thank you. So my name is Mona. I'm the manager of Stage 1 and the Bridge Program Policy Support Unit. I'm really happy to be here with you all today. One thing that I kind of wanted to start by pointing out is that the families who receive CalWORKs are very rarely interacting with just one system. Many of them are connected to multiple professionals and services at the same time, as I'm sure you all know. They may be working with social workers, educators, early childhood programs, healthcare providers, and other community-based organizations. And each of these professionals plays a really important role in supporting families and helping them to navigate resources. So, for example, a healthcare provider might hear a parent mention that they're trying to attend job training, but they don't have someone to watch their young child. Or a social worker, I think I saw someone here that is a social worker, they might be helping a family stabilize housing or employment and then realize that childcare is a barrier to making progress. And in many cases, the professionals interacting with families are some of the first people to hear about these challenges. And so that's why, like Jane mentioned, the awareness of these programs like CalWORK Stage 1 is so important because even if connecting families to childcare isn't a part of someone's formal role, simply knowing that this support exists can make a really meaningful difference. And so sometimes the most powerful thing a professional can do is ask a simple question of, do you have reliable childcare while you're working or attending these program activities? And that question can open the door to connecting families with resources that they may not have known about. And these community partners also play a role in helping families navigate these really complex systems that can feel very complicated or overwhelming. And so when trusted professionals across the system start to understand how Stage 1 childcare works, it becomes easier to guide families towards the help that they need. And then ultimately, supporting families is a shared effort in line with the theme of this CAP month. And so, when different systems work together and share information, it helps ensure that families don't fall through the cracks and that children have safe environments while their parents work towards stability. And next slide, please. Thank you. All right, so let's shift the focus a little bit to the role each of these plays. Like I said, many families interact with multiple systems through schools, healthcare providers, social services, community organizations. And so even if connecting families to childcare isn't your primary role, you may still be one of the professionals that they really trust. And so we just want you to take a moment to think about your work. I know we've already done some activity around this, so if there's anything additional you want to add, but when might you encounter a family who's struggling with childcare? Like, what might that even look like in your day-to-day interactions? Sometimes families may not even, come out and say, I don't have childcare. There may be other kind of hints and signs that show up. And so if anyone would like to share either in the chat or come off mute, and then if you do notice that need, is there any steps that you've been able to take to help connect that family to support?
I think for me, I could say a lot of the times, like my program is so unique in the sense that I work with people who have been released from a state prison. So when they come back from being released from, incarceration, they want to be with their children and, gain back that relationship and like that like be involved in their children's lives. And so there's like that like attachment piece. And so I normally tend to refer to like more counseling, more, clinical work that they could do. And then also, I notice that when they are not consistent with their appointments, like I can tell when like they're running late or they have to reschedule often and it has to and it normally relates to like their children. Like they like, they're sick or like the person that was supposed to be taking care of them is not taking care of them today and so they need to like step in.
Yes. That makes so much sense. We're going to share some resources at the end, Marissa, and for the alternative payment programs that Alana mentioned earlier that administer the childcare services, a lot of them do some really great programs. And you made me think of there's one called Inside Out Dads, and it's specifically for dads in this situation that have recently been released from prison. And exactly what you were saying, it's all based around that. There's like group therapy. It's really cool. So depending on what county you're in, when we share how to find your local APP, that might be like a really good resource for you to refer your families to. Thank you. And I did put the facility search in the chat as well. So hopefully that's a good resource. I'm always surprised. I don't have children either, but I have a lot of friends with many kids who've been using childcare. And I'm always surprised how few people know that this exists, that you can, it's all public information. Leslie says, for me, working with families to get into permanent housing, a barrier is finding childcare to be able to increase their income. That's so true, Leslie. And a lot of these programs that we're going to be talking about, there is seeking housing as a need. So if they qualify for these programs, that can be what's considered a qualified need. So while they're even looking for housing, sometimes childcare might be helpful. So we will be sharing those local resources too. Thank you. Let me give it one more second. All right. Um, I think we can move to the next slide, please, Molly. Thank you. So, this year's theme focuses on creating safe futures where families can really thrive. And so, Stage 1 childcare contributes to that vision by providing immediate, tangible support when a family may be under significant stress. And when parents have safe childcare options, that they feel empowered to choose. I want to add that that's not on my talking points, but you all brought up such a great point of using that facility search so that they feel empowered that they're choosing the best option for their family. That's going to help them be able to focus on employment, housing, and long-term stability, that kind of thing. So thank you. And we can go to the next slide, please. All right, so we want to make sure everyone here knows how to tangibly help a family connect to Stage 1 services. And so the first step is identifying if the family you're working with is currently receiving CalWORKs cash aid. Because if they are, they in many cases are already going to be eligible for childcare through the CalWORKs system. And if they're not receiving CalWORKs cash aid, but maybe they could benefit, you could connect them to a county welfare department office. We are going to be sharing a PDF link at the end of this, which will have a website where you can locate your local county welfare office. And then if they're receiving cash aid, you could encourage them to connect to their CalWORKs worker. Because Stage 1 childcare is administered by counties and tied directly to a family's CalWORKs case, the county worker would typically be the best entry point for initiating those services. And then these are the agencies I was talking about earlier, the AP and R&Rs. So another helpful connection point is your local child care resource and referral agency. We often call them an R&R. And then these agencies help families identify available child care providers in their area, and they can walk them through their options. So someone could call the R&R, say, I need care Monday and Saturday. I need evening care. Here's where I live. They get individualized childcare referrals. And then there's also subsidized childcare programs that are not tied to cash aid. And those eligible families could qualify again, even if they're not on cash aid. And so we will share the R&R directory at the end of this presentation, but it's rrnetwork.org. And then again, I think finally, sometimes the best and most helpful thing professionals can do is to simply share information. Again, a lot of families don't realize that childcare support may even be available to them. And so by helping families ask the right questions and connect to the right places, professionals can play a really important role in helping families access childcare when they need it. And we can go to the next slide, please. Thank you. All right, so as we start to wrap up, I want to again just summarize some of the few practical ways that professionals and community partners can support families after today. You can take some time to learn about the childcare resources available in your local community, knowing offhand which agencies, which organizations provide these services can make it really easy to guide families. And there's one in every county. So there's going to be a county office, there will be a resource and referral, and alternative payment program. In most counties, the R&R and the AP are the same agency, so that makes it a little easier, but there is one in every single county. And then when you're working with families who could be eligible for CalWORKs, just consider, asking the question about their childcare needs. And again, we encourage you to build relationships with your local partners, the resource and referral agencies, or the county CalWORK offices. Collaboration between systems can ensure families receive the support they need. And sharing information by meeting with your local county offices and R&Rs, you can obtain flyers and pamphlets that you could share with the families you work with. You can also exchange information so that maybe the services that you provide, if families could benefit from, they could also share your information. Increasing awareness of programs like Stage 1 childcare helps more families access resources that support stability and safety. When families are facing multiple stressors, as we know, it can be very overwhelming to know where to start. And by helping connect families to childcare resources, we can reduce stress and support safer environments for children. And next slide, please. We did just also want to mention, because we felt this was important, alongside the childcare services, we wanted to highlight a few additional supports that are available to the childcare providers who are serving CalWORKs Stage 1 families and beyond. As we all know, and Jane had mentioned earlier, childcare providers play a really vital role in families and children's lives. And so we want to ensure that they have the training and support they need to prevent abuse and to support healing environments. So, firstly, through what's called the Emergency Child Care Bridge Program, providers may have access to trauma informed care supports, which focuses on helping them create environments where children who have experienced trauma feel safe, supported, and understood. Again, those local R&Rs offer those trainings to providers. In my experience, those trainings are open to everybody. So if someone here is even interested in attending them, by connecting to your R&R, that might be a good professional connection to make. And we will be sharing the R&R directory at the end of this presentation. There is also an infant and early childhood mental health consultation services that's available. These services specifically connect childcare providers with mental health professionals who can help with many things like supporting social emotional development or navigating challenging behavior. There's an array of services available, and we will also be sharing that resource. Again, it's called the Infant and Early Childhood Mental Health Consultation Network. Very long acronym, IECMHC. I almost feel like I should just read it out. The acronym is just as long. And then lastly, providers can access free trainings through California Early Childhood Online. We call that CECO. These trainings cover a range of topics. They're completely free. They include trauma-informed practices and behavior supports, and they're available online to help providers build their skills on their own time. And we'll also be sharing that resource, but again, it's the California Early Childhood Online CECO. Thank you all today, and it was nice talking to you. I will pass it to Tracy for the next slide, please.
So just to kind of review, the key messages from today is that childcare is a critical support to help stabilize families and help them to move forward. And then programs like Stage 1 are an important part of the prevention ecosystem. Childcare supports safety, stability, and the opportunity for the entire family. Next slide, please. This is our final slide. Well, not the final, but our final slide. Thank you for your time today, and we will be available if you have some other additional questions that you'd like responded to. I'm not sure if anybody has anything additionally that you'd like to ask.
While we give everybody a minute to think through their questions, and if you're wondering anything about maybe a scenario you've been through that you can ask a question on, I'll give you a minute to do that. But hello, my name is Casey White. I'm a training coordinator at California Training Institute, here working in the background for you. I did want to let you know that today's breakout session, of course, is being recorded. And so you will be able to access the recording of today's breakout session. And then I also dropped the link to the note-taking slides for you as well in the chat. And then with that being said, we will have next week's webinar on April 8th. And so make sure to register for that and attend that as well. And then, oh, great, we have a question. So I will go ahead and I will pause while you ask that question.
Okay. Hi. My name is Selene. I am a social worker at Public Counsel, a pro bono legal firm based in Los Angeles. I work with transitional age foster youth, and a lot of my clients are young adults who are also young parents, who many of them have mentioned or talked about being enrolled in CalWORKs, but it always sounds very surface level. I literally just spoke with a client yesterday who was talking to me about CalWORKs, and she was like, "I just get food," like, and so it just kind of indicated to me like the impact of trauma and people's ability to receive information um, really impacts the way that people engage with programs like CalWORKs, right? Like, I think um, for my clients, there's none of them can really kind of uh express an understanding of like there's stage one, stage two, stage three. There's all of this like background understanding and information of this program. And yeah, so one, I want to say that this is incredibly helpful for me as a social worker to learn about to learn more about CalWORKs as a program. But I have a few questions. One is, how available are county workers? Yeah, we can start there.
I don't know, is someone from the team want to respond to the questions? You have more expertise.
I can take a stab at this one. I mean, I think in an ideal world, we want them very available. And every county is different. There's a lot of turnaround, of course, that occurs, I think, across our field as a whole. But I'll share an email address in the chat. And so if there's a parent that's having trouble reaching their county worker, you can always reach out to the state. I know it's kind of a last resort, but we have facilitated discussion before in the past. So that's an option, Celine. I'll share that with you. And I also just kind of wanted to like acknowledge what you said about connecting families to services who have experienced trauma. And county offices can be scary places. Like things that are associated with the government can be scary places. And I completely understand that. I think a good place to start sometimes. Can I ask what county you're in? Is that all right? You may have already
Yes,
said so.
I'm in Los Angeles County.
Okay, so for you, it will depend on zip code. But I think, I don't know if you've ever connected with your local resource and referral. A lot of the nonprofits, like I feel like it's a really warmer environment for families sometimes. And so that might be a good connection for you to make to go and talk to them and kind of see what services they offer. A lot of them have so many different grants and offer different services. A lot of them also have like parent education classes where you can go and hear like what the different childcare subsidies are, who's like what eligibility requirements are, because there is so many different options and services. And so that would be my recommendation. I would connect to your local R&R if you haven't already, um, and see if they might have local resources. And if there's families that are a little nervous to go to the county office, maybe they can start there and that like help them build a bridge. I don't know if that's helpful. I hope it is.
Yeah, thank you so much for sharing
I
that. Yeah,
think
I'll definitely look into that website that you mentioned earlier, the rnrnetwork.org. Yeah, so thank you for sharing that. Yeah, my second, I guess it's like a combination of question and comment is just thinking about, how this program is incredible, but the information that is used, to put it bluntly, is not digestible at all. The website, the facility search welcome, it sounded amazing when you were talking about it, and then as soon as I clicked on it, it just felt like, okay, this is definitely not client facing. Because if I was a parent trying to figure out how do I find someone in my community, I'm seeing license and providers and all of these words that are irrelevant if I was a parent. And so it feels very much like, okay, this has to have a middleman, a social worker, and I don't think that's right. I don't think that's just. I think this information should be accessible and digestible for everybody, and it shouldn't require a master's degree like me to be able to work through it and understand it. And then I know there's also resources on what should you look for when thinking about a childcare facility that's also not super digestible. And I'm grateful for me myself to be in the position to support my clients and what does all of this mean and how can we break it down to feel like, okay, we can actually go start somewhere. But yeah, I just wanted to share that I really hope that in this day and age, CDSS can tap into some funding resources that can improve the website so that way it's truly a resource for community members directly and not middlemen like me.
I
Thank
think
you for
that's
that
such.
feedback. I think that when you're speaking of the CCLD, our Community Care Licensing Division. So CDSS is a huge organization, and that's a complete other division. But I do understand your point, and I think that it's well made across government entities. There is a lot of government talk that goes into into our documents, and we are actually working toward making better resources that are more digestible by the average citizen. I would suggest also from the CCLD standpoint, there are childcare advocates, and that's another resource that we can add into the chat. And there are people that are able to help navigate the system and also respond to specific questions and needs that you have regarding community care licensing. So happy to share that with you. I also wanted to just touch back on what you were talking about in your role working with parenting youth. One of the challenges and is one, and like all the things that Mona said and you said about government, the county office could be kind of an unwelcoming or difficult place to navigate. But they're also, I would just suggest when you speak with your clients that you let them know that they should let their worker know, the worker within the CalWORKs area, that they need childcare. Because sometimes they should be asking and they should be offering if they know that the participant is receiving services, but it also can be just as simple as saying, oh, and by the way, I need childcare. And then we touched on it a little tiny bit, and this is a totally different program, but the Emergency Childcare Bridge program for foster children is for parenting youth and non-minor dependent parents. And so I'm not sure if you're familiar with that program, but that is also under Mona's jurisdiction. And so we'd be happy to share more information with you about that offline.
I was gonna say I'm happy to help you find your local R&R too, Celine. I'll put my personal email in the chat right now for anyone if you just need assistance navigating. I used to work at an R&R, and I no, first I'm going to tell a story because I think we have time. But when I graduated with my master's degree, I didn't have health insurance and I tried to apply for Covered California. I had no, I was lost. And I remember thinking, I have a master's degree and I can't navigate this government website. It was such a wake-up call for me. And I ended up going to a local facility. They helped me do the application. The man like sat with me and went through it. And the reason I mention that is a lot of the resource and referrals will do the same. And so I used to work at one, we work with many. They will actually sit down with the family and kind of help walk them through all the different web pages. They'll help them develop that individualized list of providers, and then they can do the facility search with them and print out like here's the last 3 reports. So they'll definitely do stuff like that if families ask. So I'll put my email address in the chat, and I'm happy to connect with you.
And we've referred to the resource and referral agency or programs. And for the child on the child welfare side, they have the family resource centers. So child care resource and referral agencies have a lot of similarities to family resource centers. As a matter of fact, in some of the smaller counties, they're all of it. They're the family resource center, they're the resource and referral agency, they're the alternative payment program APP that was referred to earlier. So they're community-based organizations that help to support the community. Just to kind of draw a parallel if you're familiar with the family resource centers.
Yes, I consistently refer folks
Yeah.
to those spaces because they've been a great resource. Thank you so much for all of these resources and information. I greatly appreciate it.
And we appreciate you. We definitely are grateful that you took on our charge for engagement, and hopefully those the rest of you that are listening in, you found something valuable in the conversation. But thank you for being brave and speaking out and asking your questions to help the conversation move forward. So, in saying that, we again thank all of you for being on the call today, and it's been a pleasure to be with you. And really hope that this was helpful and that you took something away from your time with us today.